So what are the advanced techniques that you are implementing in Ferty9 right now?
So we have many techniques, we have many instruments, like we have separate culture incubator for Day5, because till Day3 it's not a big problem. After Day3 to Day5 we need separate incubator, that because it will mimic the mother's womb, so we need less oxygen supply. So for that we have a separate incubator, that is like G210, that is one of the that means advanced machine in as of now in the market. So other than that we have Ziltrix is actually, because like we are doing our job, like morning we are coming like around 9 o'clock, we will be leaving by around 5 o'clock, but after that who will be monitoring these systems and instruments and all. So even in our sleep also sometimes we will be afraid, okay, what will happen what if current failure happens, means what will be the problem. So we can't analyze all those things. Our body will be there in the house, but mind will be in lab only. What if the power supply is gone for whole day? That's it, because our oocytes and embryos, they're very very sensitive actually in our body. So everything is happening inside our body. So our body is actually that means what there is a big defense system is there, so nothing will go inside easily. So if microbes or any other particles will not grow. When we are taking these particles outside of, means our oocytes and sperms outside of your body, there will be lot of problems. They have to face infection,
outside
environment, yes. So this will be a little hard for them. So we need to monitor them, we need to give a proper environment for them. So we need to see everything, we need to analyze everything. So for that we have Ziltrix. This is actually out in India, this is one of the advanced system we are using right now. So this will monitor 24/7. So if there is a power surge, if there is any power failure happens, we'll get the notification. So we have 3 layers actually. So 3 persons will be notified actually. So if there is any problem, one of us will be assisting that and we will rectify it. So it will be like no problem will be happening. Then one more is actually we have RA witness system, that is very very crucial in our IVF lab, because most of the patients will be having that dilemma, okay, what if something may happen, mix up may happen. So for that we have to assure that we have RA witness system. Other than RA witness system, we will be having a manual witness, because if I'm doing a procedure, there will be like one of my colleague will be there, he will be assessing everything. If I make some mistakes or anything, means he will be assessing everything. Other than that we have this advanced system. So here every tags, like means if patients are coming, so we will be giving a separate tags for them. This will be like ISBN in library, okay. So this will be for them alone. So we will be tagging each and every, that means we are using dishes, tubes, everything. So everything, this tags will be given. So if we are some other patient is coming inside in this range, means it will be a big alarm mismatches. We are providing that that means what reports to patients also, they can also monitor. So the transparency is also there. So like that we have a lot of advanced the instruments in our lab.
So how will be your day at lab, sir, from morning to evening?
Yes.
Like, do you feel any hectic times? Like, how will be like your dress, or how will be it?
Yeah, we'll be wearing a scrub suits actually. So when we are entering into inside lab, we have 5 layers of that means what sterile, unsterile areas. So this area should be very sterile where we are working embryology. So the entry to for persons is very very limited. So only myself and one of my colleagues. So 2 persons should be allowed inside the lab. Even that means other persons are not allowed inside, because to reduce the contamination, reduce the outside particles is coming. So when we are going inside the lab, we will be changing our dress, we will be completely in our scrubs, we will be wearing our caps, then mask. So we will be entering inside. Even our slippers, we will be having separate 3 sets of slippers from unsterile area, semi-sterile, then sterile. So we will be wearing different chappals also. So once we go inside, we will be what we will be doing in a day. So our regular day will start with a prayer first of all. Whoever enters inside the lab, so whether it is a Hindu, Christian, Muslim, it doesn't matter. We'll be having like around 1 minute prayer. We'll be getting inside, because at last God only help us. Even though we are doing all these things, God's help is very much needed in our lab. So once we enter inside, we'll be having a departmental that means meeting. So we'll be planning what will be the next plan. So that full day plan we'll be having. Then we'll be doing our quality assessment and quality control, because we need to, because if a process is starting within 1 hour, means before 1 hour we have to assess everything. Every instrument is working properly fine or not. We'll be assessing that 1 hour prayer. After this 1 hour, we'll start our day. So once our all work is over, we'll be doing again the quality assessment. Then only we'll be leaving. So it'll be like around 6 o'clock or 7 o'clock.